Breast reconstruction is an important part of the treatment of breast cancer. It's not just considered something which is nice to do if you can. Breast reconstruction is covered by Medicare. It can be done completely in the public hospital system. However, there is a waiting list and waiting times and the like. It can be done in the private system, and I operate in both. There are essentially three ways of performing breast reconstruction. Reconstruction can either be performed with implants, it can be performed with the patient's own tissue, or a combination of the two. In terms of which is going to be the right decision for which particular patient is something that is a discussion between you and your plastic surgeon. Breast reconstruction with implants can be done as a single stage at the time of mastectomy. So at the time of mastectomy, the muscle of the chest wall is lifted up and a breast implant like this is placed underneath that muscle. Sometimes we also need to use some donated human skin as a sling in order to hold the implant into position. Drains, which are hollow plastic tubes, are then placed above and below the muscle. All the sutures we use are dissolving, and patients normally go home within a few days. As you can see, the breast which is created is an idealized, perky, youthful breast that will not change with time. There are some potential downsides of breast reconstruction using implants. An implant is a foreign material. The body will form scar tissue around that implant. The scar tissue is formed a capsule. Some patients experience what's called capsular contracture, which is where the capsule around an implant becomes very hard and can actually distort the shape of the breast and, in worst case scenario, even cause pain. More recently, we have identified a rare complication of the capsules around implants. A very small number of women have developed a rare form of blood cancer called an anaplastic large cell lymphoma, or ALCL, in the capsule around their breast implants. This can happen either with a cosmetic or a reconstructive breast implant. It itself does need surgery, but in the overwhelming majority of cases is not a serious tumour. It is not a breast cancer itself, it's a type of blood cancer which is within the capsule itself. Another type of breast reconstruction is where we use the patient's own tissue to reconstruct a breast. This is widely considered to be the gold standard breast reconstruction. The most common type of tissue we use is tissue from the tummy. So if a patient has excess skin and fat in the lower tummy, the kind of tissue we would normally remove and throw away as part of a tummy tuck, we can use that tissue, take it out of the body with its artery and vein, find an artery and a vein in the chest, and join that artery to an artery and a vein to the vein in order to re-establish the blood flow to that tissue. We then give the patient a tummy tuck to improve their abdominal contour. So this procedure has two components. One is the reconstruction using the patient's own tissue that will actually lose weight and gain weight with them, that is not a foreign material. And the second component is we improve their abdominal contour by giving them a tummy tuck at the same time.